a loved one wheeled into their hospital is a nightmare scenario for doctors.
Can I help you?
Inside Royal Perth, Western Australia's major trauma hospital, life-saving work goes on 24/7.
So no history of drugs? No.
This busy facility treats more than 70,000 patients a year, and it's that work that Dr. Tim Bowles wants his daughter to witness firsthand. He sees the impact of trauma on families every day.
So I met John on Monday night. He's had a motorbike accident, and as you can see, he's had a fairly nasty injury to his head. He's on the ventilator, so he's unconscious and sedated, so he's got that breathing tube which is supporting his breathing at the moment.
John did nothing wrong. He was wearing a helmet and came off on a sharp bend.
Yeah, it's just the overwhelming, it's just the waiting.
Just the idea of, for Eva to be one of the patients here, I can't even imagine what that would be like, and I try to put myself in the position of all the patients here as well, and I just can't even imagine what they're going through sometimes.
Eva is one of hundreds of children brought through this hospital every year to observe what's happening, with the goal of making them think twice about the risks that would make them patients here.
X-rayed him. It was actually really emotional because it was just really hard to hear how, just what happened to them.
These rooms are filled with heartbreaking stories. Every patient has had their life changed in some way. Doctors hope at least one is able to break through to these young people and influence the decisions they make.
Conveying the human cost of a bad decision or a bad mistake is very difficult, particularly for a parent or teacher. I think being able to see the consequences yourself is much more valuable than being told those consequences.
This program is the first of its kind in Australia, launched in 2006 after Dr. Monica Gope came across a similar initiative while working in Canada.
It had quite an impact on me, and I sort of do this thing every day. So we knew that we needed in Perth to have a little bit more outreach into our community, and that seemed to fit the bill.
The program's also been tailored to target at-risk youth in the juvenile justice system.
Some obviously find it quite confronting and upsetting being in the setting. I'm usually impressed by what they take away in terms of the actual message, which is sort of thinking about what they're doing and trying to make safe decisions and safe choices.
We unfortunately see people like Max pretty much every week.
A powerful lesson that may just save a life. Darina Zadvirna, ABC News.